what their peak flow is for the beginning of the day.
Do you have a peak flow meter here? Let's demonstrate exactly what it is you're talking about.
Well, I do. And the peak flow meter comes in a box with lots of instructions. In this particular one, it's written in English as well as Spanish. But it gives the information about finding out what a predicted peak flow is. And like I said, it's the thermometer of the lungs. And based on how what the predicted is, if it's between 80 and 100% of predicted, then that when the child blows into this device, that would mean that they're normal peak flow. And so what having the device set up to where they have different zones, and the zones are written just like a street light or a signal light, with the green for good, for the yellow to yield or to slow down, and the red to stop. And those are kind of the same type of terms that we use when we talk to the children about asthma and doing their asthma action plan. But let me show you how we actually...
Let's take the temperature here.
Let's take my temperature. This should be fun. Now the first thing we do is teach them to make sure that the little yellow indicator is on 0, so that it's zeroed. Have them relax. Take maybe a deep breath and exhale. Then sit up straight. Take a big deep breath in. And have them blow out forcefully. Now, kids will really use this they'll play games with you. And there are times that they'll actually do the spitball effect and try to get the yellow indicator all the way to the end.
Well,
And that can happen. So once you take your breath, you shake it down, zero it, and this is what, if you ever see your children cheating, this is the way it looks. Now I didn't do a very good job there, but you could tell the difference in the sound. And as a respiratory therapist, that's what we're trying to look for when we're working with the kids.
Well, in my practice, what I've seen, just like kids will take a thermometer and put on the light bulb and say, Mom, I can't go to school, my temperature's 110. I've seen it go the other way too, where they don't really give a very good effort. How do you encourage them to give that good effort they need to have a reliable measure?
There are different visual things, like blow out the candles on a birthday cake. You're really wanting to take in a deepest breath as you can and forcefully blast out the air. And a lot of times we'll make the sound with them and encourage them to blow out and blast the air out. The one thing that we do is we have them repeat this maneuver 3 times because we're really wanting to get a good effort. In my experiences, there's sometimes the children will say, oh, I don't feel good, maybe they don't want to go to class, and they can make their peak flow look bad by just giving a poor effort. So it's very important that you get a good effort and that parents know what their children's peak flow should be.
How about some of these other devices here? I see a number of tubes and things with masks.
Well, if I can back up just a little bit, when we're working with children with asthma, we want to find out, do you really have asthma? And so getting the diagnosis is the first step. Once they've been diagnosed, then we start working with them on developing what we call an action plan. And in the Doc Monahan packet, there is a parent guide that has all of that information listed for the parent, and the child can actually write down what the physician really is the one who will go through and develop this plan. This plan is then given to the school nurses, to the parents, any caregiver, so that they can help monitor their kids' plan of care with their action, with their asthma. In the booklet, there's also how to use the True Zone, as well as some of the other devices here. So once we've got an action plan in place, then that's when we start teaching them how to use their peak flow meter. Once they've used their peak flow meter, what do you do with that number? There's what's called a diary. And with a newly diagnosed child with asthma, the diary will be used during the first 2 weeks after they've been diagnosed to find out what their personal best is with their peak flow. And so every day, sometimes twice a day, they will monitor their peak flow and they'll document or they'll track their peak flow for 2 weeks. Then they'll return into the physician's office and they'll go over that information and they'll decide then what their true best peak flow is at the time, and not just what's in some book that researchers came up with. Once we've identified that, we've also started them on medications. Many kids use meter dose inhalers, and I happen to have one here, or one that looks like, there's several out on the market, so they all look different. But you've probably seen on TV, in movies, where someone will take one of these, they'll stick it in their mouth, they'll press it down, and that's the way you use asthma medication. Wrong. That is the worst thing that you can. You're not doing anything but putting medication in your mouth and letting it.
Well, now your mouth doesn't breathe, so I guess your lungs still
So
do.
for the older kids who can use a mouthpiece, this is what's called a chamber, and this happens to be the Aero Chamber Max, and the way it's used, is it okay if I demonstrate that for you? This is the mouthpiece, and this is the meter dose inhaler that has a cap on the end that's taken off, and it's placed inside the chamber here. You always shake your meter dose inhaler.
So you're automatically shaking.
And a lot of people shake, shake, shake because they're trying to figure out what they're going to do next. And again, you want to make sure that they're sitting in an upright position, that their airways are open. Take in a deep breath and exhale, taking that all out. Then depressing.
Yeah, usually in my office I do the Mr. Ed technique where I count it out
count
with
with
my foot, but that's...
What I did was use the chamber as a space or holding chamber so that the medication is held here until it's breathed in very slowly, so that the medication goes to the lungs and not to the tongue, not to the back of the throat, not to the inside of the mouth. This is the best way to deliver a metered dose medication. And generally you'll take 2 puffs of this or whatever the physician has prescribed. It's easy to tell with this type of device whether they're actually being able to trigger this valve opens here, and you can see that the medication's being delivered. It's easy to clean. It's cleaned once a week by just taking this off, cleaning. The one drawback, and you may want to say something about this too, is with asthma, compliance is such an issue, not only with the kids but with adults. And one of the problems that we've seen is having people, especially adults, say, I don't want to carry this device around with me. So it's important that we educate them as to exactly why are you using this. There are other devices for smaller people. This was for an infant, and the way that this works, this is a mask that fits over the face, and I have instructions sheets here for you, and you're able to actually visualize each time the child takes a breath, and you can see this little flutter. So the parent or the caregiver can tell, yes, the child has taken their medication. Do they only take 1 breath? No, 6 with these, so that you can make sure you're delivering all the medication.